Hello, my name is Dr. Fahim Khan. I am a consultant rheumatologist at the Otivan Hospital in Kilkenny, Ireland. And I practice rheumatology and pain medicine. And I want to talk to you guys about Calmare therapy, which I want to talk to you about how this treatment works, what are the indications for the treatment, and the benefits achieved with this treatment. So Calmare therapy was invented by Professor Marineo from Italy, and the Calmare therapy got FDA clearance and has been in use mostly in the United States since 2010, and I'm the sole provider of the Calmare therapy in Ireland since it was initially approved by the FDA around 2011, which I've been using Calmare therapy. And in fact, I'm the sole provider in Europe, apart from Italy, where Calmare therapy was initially invented. So the name Calmare or Calmare in Italian means calming, soothing. And that's actually true about the pain relief that is achieved by this treatment. So how does Calmare therapy work? Calmare, this is the Calmare device machine, and you can see these different color-coded electrodes are there. So this machine generates a pain-free impulse. That's how it is designed to do so. And patients who have pain, these electrodes, which look like the ECG or EKG electrodes, are attached to the skin, on the top of the skin where the patient has pain, to the body, in the area of the pain. And the machine generates pain-free impulses. So the new impulses from the machine using these electrodes, when they attach, let's say if I have pain in my arm and if I place one here, one there, so these impulses travel through these electrodes onto the skin, going through the tissues, through the nerves, to the brain, blocking the existing pain or overriding the pain. And thus the brain perceives pain-free impulses and your pain is immediately blocked. So this machine has shown great results, particularly in patients who have nerve pain, which is called neuropathy or neuropathic pain. And there are many types of resistant neuropathies, like conditions complex regional pain syndrome or RSD, which is called reflex sympathetic dystrophy. And literally speaking, there's no treatment available for it, but with this treatment, thankfully, patients have shown over 90% improvement in terms of their symptoms. And there are many different types of neuropathies. For example, patients who get chemotherapy, and after chemotherapy they get nerve damage or neuropathies. It is also indicated for chemotherapy-induced peripheral neuropathy with excellent results. And we are looking at figures of over 90%. And these figures are actually taken from most of the reputable centers, particularly in the US, where they're using Calmare therapy, and with my figures, I've seen more or less the same success rate here in Ireland treating these conditions. We also have patients who have neuropathy caused by conditions like shingles neuropathy or herpes zoster's neuropathy, which this treatment is used for, and diabetic neuropathy, and other condition would be trigeminal neuralgia and neuropathies, etc. Patients who suffer from back pain or pain traveling down the legs, which is called sciatica or lumbar radiculopathy, this is an excellent treatment for it. And patients who have had spinal injections, surgeries for the spine, failed back surgery, they are not responding to medications, and there are a lot of medications like morphine, opioid drugs. Calmare therapy does help them. So it's a wonderful treatment for patients who have back pain, neck pain, conditions like that. It's also used in patients who have severe resistant pain like cancer pain. And most of the trials on cancer pain have shown that patient did very well with pain scores improved, and most of the patients who were taking narcotics type of medication like morphine, they were taken off these drugs. So it's a revolutionary treatment in terms of pain management. And there are many other conditions. For example, conditions that I would personally see in my rheumatology clinic would be a condition called fibromyalgia, which I'm sure you guys would be familiar with. Fibromyalgia, a condition that causes a lot of aches and pains, tiredness, fatigue. And instead of putting the patient on all these drugs, which unfortunately has potential for side effects, we use the Calmare therapy device, which actually helps their symptoms very well. So the treatment protocol of Calmare therapy is that conditions with neuropathy, fibromyalgia, cancer pain, back pain, neck pain, etc. And there are many other pain conditions, even Fenton pain syndrome. Up to 10 sessions of Calmare therapy are given. The treatment in some resistant type of pain like cancer pain, we can actually use up to 12 sessions, or sometime with severe neuropathy, up to 12 sessions of the Calmare therapy sessions can be given. The treatment is administered normally 5 to 6 days a week, 1 or 2 days off in between, and 10 to 12 days of the treatment, which is over. During the first session of treatment, we see very immediate pain relief, which has not been seen even with pain injections, things like that. And the duration of each treatment varies from condition to condition. For somebody who has neck pain or non-specific type of musculoskeletal back pain, if you want to use Calmare therapy, 20 minutes minimum session is used. But neuropathies, we use somewhere 30 to 45 minutes of session. And in resistant cancer type of pain, up to 60 minutes of session can also be given to a patient. The treatment is literally pain-free. You don't feel any pain with the treatment or after the treatment. And the good thing about this treatment is there's no known side effects. So patients do not get any side effects from this treatment. So there are no drugs used, no injections used. Calmare treatment, and we see very good results with it. During the treatment, when the electrodes are connected to the skin, like EKG type of electrodes, and we switch on the frequency, patients would experience slight bit of tingling type of sensation, which is barely felt. But we adjust the frequency according to the threshold of the patient pain, so that they don't feel any discomfort during the treatment. So this frequency is adjusted in according to the level of threshold that patient could tolerate this sensation. But this sensation is not unpleasant. So there are many centers, if you look at the United States, they're using all the top pain centers, reputable institutes, they're using Calmare therapy as well. And thankfully, since I have this Calmare therapy, I've seen great improvement with patients. They attend my clinic, and some patients are coming from Europe, apart from the UK. Some patients have come from many other European countries where this treatment is not available, and unfortunately they're left at the situation when they're taking too many painkillers without any improvement in their symptoms, particularly neuropathic type of pain, which can give very debilitating type of pain. We provide Calmare therapy in Kilkenny in my office, where I normally assess patients, and we book the patients in according to the timing that would suit them. And the patients normally get in touch with my secretary first to see what appointment would suit them, and from there on we normally book them in, but normally up to 10 sessions are used. And Kilkenny is a city with very well known for tourists as well. It's really a very touristy city, Beautiful city, medieval city, castles, and beautiful walks, things like that. So patients and their excuse me, and their families, when they are here, they are very nice hotels. Accommodation is not a problem. They come in and they really enjoy spending time with their family and family member who is getting the treatment. And patient really enjoy the treatment session. And once we see their pain score is achieved, it is a pleasure for us as well to provide such a wonderful service that we have. So if you guys have any questions, concern, please do not hesitate to contact me. My website is www.arthritisandpainclinic.com. My email is rheumatologyclinics@gmail.com, rheumatologiclinics@gmail.com. Thank you very much. Bye-bye.